My name is Mike Sylvester, and I live here in Duluth, Minnesota. And my journey began on December 16th, 2016. I was watching a hockey game on television, and I noticed I had some chest pain. So I got in my vehicle and drove to the hospital, walked into the emergency room, and they determined I was having a heart attack. I had a 30 to 40% blockage, and the next morning I went into surgery, and the next thing I remember, it was about a month and a half later. It was the stress of the surgery that led to me having an aortic dissection. And an aortic dissection is when your aorta tears. And I was on a ventilator for about 4 or 5 weeks. And it took me about 2 months to recover. I went into physical therapy and ended up having a complete recovery. That was spring of 2017. And about a year after I got out and went back to my job and resumed my life, I had a routine CT scan and I got a call from cardiology. And when you have heart issues and get a call from cardiology, one of two things happens. Either they say everything looks good or the doctor wants to meet with you tomorrow. And I got the dreaded, the doctor wants to meet with you tomorrow. I came in at 2:00 and the cardiothoracic surgeon says, you're going to need another surgery and it's going to be a really bad one. Structural integrity of my aorta was so compromised, they were going to need to do additional repairs. They determined that they could insert what's called an aortic endograft. So they put me on the bypass machine, they cooled my blood down, ran it through my body until I was essentially hypothermic and actually in a controlled state of clinical death. And I remember waking up and the surgeon said, everything went really well, you're going to be fine. And the next couple of days were kind of a blur. And what had happened is when they warmed my blood back up and circulated it through my body, a tiny little clot formed and ended up in my right middle cerebral artery in my brain. And I remember hearing my wife say, the neurologist is here. And I was thinking, neurologist? Why is a neurologist here? And he said, Mike has had a cerebrovascular accident. And I remember thinking, accident? I didn't have an accident. I came here for surgery. And then he clarified, it's called a stroke. So the next few days after that were also a blur because I had complete left side paralysis. I had no use of my left arm or left leg. I was unable to speak and I was almost completely blind. There were conversations going on about what they were going to do with me because my stroke was so severe. And they finally agreed after quite a few discussions that they would send me into the rehab center. At the rehab center, I would get up at 7 every morning. I would eat breakfast at 7:30, then at 8:00, the therapy would begin. I would have speech therapy, occupational therapy, physical therapy, and psych therapy for 8 hours a day. And I was brought into the facility in a wheelchair, and I remember thinking, it'll be a huge accomplishment just if I can walk again. And then also, how am I going to go back to my job? Am I going to lose my house? Are we going to lose our vehicles? Are we going to lose everything? I would go back to my room at the end of the day and just pass out from exhaustion. After about 2 weeks, I was able to get out of the wheelchair and use a walker. And then I was able to get rid of the walker and use a cane. And I used the cane for about a week, and then I was on a stationary bike and then on a treadmill. It's kind of akin to watching a tree grow. You can stare at it all you want. You can't notice anything happening. But then if you look at it 6, 8 months, a year later, you've noticed that there's some growth. And so after about a month and a half of intensive inpatient therapy, the neurologist came in and said, I think we can discharge you, but you're going to need to do 3 to 4 months of intensive outpatient therapy. So I was like, I'll do how many ever months you need me to do as long as I can go home. I did my 4 months of outpatient therapy, and then I had to take a special driving test to be able to drive, which I passed, and then I was able to go back to work. And they said, you're lucky just to be alive, but to be able to function is a whole other thing. So if I could go back 5 years and change my lifestyle, boy, would I ever do that, because I put myself in a risky situation. I had a diet that was very high in fats and cholesterol and very high in sodium. You need to see your primary physician on a regular basis, and you need to get your blood pressure checked and get your cholesterol checked and have them listen to your heart, because they can detect things like heart valve disease sometimes with the stethoscope. And I had aortic valve damage, and had I gone in, maybe they would have detected that ahead of time. So I think people need to be more conscious about seeing their primary physician. And if they have the risk factors like high cholesterol, high blood pressure, and if they're a smoker, if they have diabetes, all these things can lead to heart and vascular problems. They can also lead to stroke. So they need to manage their risk factors. They need to take their meds, follow their doctor's orders. Because if you don't, you can end up like me where you have 6 heart surgeries in 5 years. And I was one of the lucky ones. I was able to survive, but not everybody is going to be so lucky. So if you don't manage your risk factors, you could end up dying, or you could end up permanently disabled or out of a job and lose your house and your vehicles and everything you worked so hard for. I know that something could happen in the next 5 minutes or next week or next month, but for right now, I'm just taking it one day at a time, living my life and being thankful for the fact that I got a second, third, fourth, and fifth chance at returning to my job and enjoying my life.